Hello, my name is Rebecca Susi, and this is my resource binder for medical speech-language pathology. So I started with this communication disorders packet, and this is a great resource to start with. It has a overview of the normal communication process and goes to talk about different voice disorders, laryngectomy rehabilitation, a summary of the different dysarthria types, as well as some apraxia, different terminology that's important, and then it goes into some of the different aphasias, and the different types, the tests that are good to use for individuals with aphasia, and methods for treating aphasia. It also talks about TBI, the early stages, middle stages, and late stages, and then ends with an overview of hearing. So I also included the PowerPoints given to us from your class. So that was the first one. This is the second PowerPoint, and in this one I also included in the back the medical terminology, which might be useful. So I included this packet and I included this one. I also included the scope of practice in speech-language pathology just as a good reference. I included the packet or the PowerPoint on neurological communication disorders. So after this, I put in the slums, the MOCA, with the administration and scoring instructions, as well as the mini mental state exam with those administration and scoring instructions as well. I also included the FAST scale and the global deterioration scale. This is a classification chart to help classify which aphasia might be presented by an individual. So it starts with the stroke patient, and then it goes to the conversational speech, whether it's fluent or non-fluent, and then from there you kind of divide in different aspects, or auditory comprehension, repetition. It's to help decide what aphasia is present. So I talked about some TBI as well, and the one that causes aphasia and concussion and TBI. This is an example of that aphasia classification, and this was an assignment for one of my classes, so I just included it to help. I included the cookie theft picture, as well as an interview assessment score form for aphasia. And this is a PowerPoint from that same class, which I thought was very good. It has a lot of different aspects of the whole process. So the interview, the assessment, variables that might affect performance, and then I included some of the tools and the treatment. I also included some sample goals of aphasia for receptive, expressive, for reading, writing, and then pragmatic. This is a really cool article I decided to include on melodic intonation therapy. And this is for the ideal candidate, a person who wants to improve conversational speech. So a lot of it is stroke or poorly articulated non-fluent speech output, so maybe some dysfluency patients. I also included some PowerPoints on motor speech disorders, which have a lot of good information about dysarthria, and I included some of the anatomy of the brain there. And this all talks about different parts of the cortex and what they are associated with. So what aphasia may be targeted. I said that so bad. Whether it's Broca's or Wernicke's area that's affected. Then I went on to some of the neuroimaging, so I thought it would be important to know the differences between PET scans and MRIs and CTs. And I also included, this is where I went into some dysphagia exercises. So I have the supraglottic swallowing maneuver, the hard effort hold swallow, tongue hold exercise, Mendelssohn maneuver, head lifting maneuver, jaw opening exercise, tongue movement exercises, tongue resistance exercises, closure of the larynx, base of the tongue exercises. And this is a bedside dysphagia evaluation form. I also included some anatomy of child versus adult anatomical structures in swallowing. I included a dysphagia toolkit because as I'm beginning my medical externship next semester, I figured it would be important to know all the different items that I should include. This is some dysphagia symptoms and treatment for all the different stages, for the oral stage, the pharyngeal stage, and then compensatory strategies to use. So bolus on the strong side, supraglottic swallow, Mendelssohn maneuver, as well as some rehabilitation exercises for the lips, tongue, buccinators, masticators, pharyngeal, laryngeal. So it goes through a lot of great information there. I included some of the different feeding levels. So level 1, this is pureed. So it goes through different foods recommended, beverages, and what to avoid. And then you may have it if thin liquids are allowed. So this is a good form to give clients or their families, just so they really know what they might be able to eat or not eat. This is level 2, mechanically altered. Same concept, what's recommended, what's avoided, and what you might be able to have if thin liquids are allowed. I included an excerpt on the 4-finger method. I included the Fraser Water Protocol. This is just a summary. I also included the penetration aspiration scale, an evaluation and treatment of swallowing disorders checklist for dysphagia. It's a screening. I also included some of this important stuff that maybe families might ask about or might be good to explain. So this is some muscles that are involved in swallowing. I included the speech therapy techniques for the errors related to cleft palate or velopharyngeal dysfunction. I included this next PowerPoint given to us from you, the patient management and medical SLP. I also included this is part of it. I included this from ASHA, speech for people with tracheostomies or ventilators. And I included this from a really great site online. It's just talking all about what is a trach, reasons for it, components of the tube, eating with it, different swallowing problems that might be seen, the Passy Muir speaking valve. And then I included the passing mirror valve readiness assessment and use. I also included, I moved on to some voice therapy, the CAPE V, and a packet on assessment and treatment of voice disorders in children. So it has a lot of characteristics, and it talks about treatment. These are the case studies given from you. I also included a PowerPoint about the NICU because I will be working in a NICU in the fall. And this is a great PowerPoint, how feeding works, the respiratory system, why a speech therapist might need to be consulted, breastfeeding, bottle feeding, signs of distress, if thickeners need to be used, goals. And I also included our quizzes because I felt like we ended up writing a lot of important information. Basically, quiz 2 is just started off with what's expected of us and the scope of the practice, which I thought it would be important to keep in mind. I also included quiz 4 because I felt like this was important for medical speech therapy, specifically for FEES and MBS, for the voice disorders. And that concludes my resource binder, which is very thick and bursting. All right. Thank you very much for watching my video. Bye.